Hi, good afternoon. I am Stephanie de Giorgio. I'm a GP, and please excuse the slightly weird lighting, but there's slightly weird circumstances around me recording this, so just bear with me if you don't mind slightly weird shadows of my glasses. So I'll introduce myself. I am a GP. I'm currently working mostly in urgent care, having been a GP partner and a locum GP, and I work within the A&E department, setting up an urgent treatment centre at the moment. I have had a professional interest in obesity along with women's health for some time, and like lots of people, one's special interests end up often coming from personal experience, and I am a person who has had bariatric surgery. I had a gastric sleeve about 3 years ago, and my other I suppose point of reference is that I also have had COVID, which wasn't much fun, diagnosed in March when we couldn't get swabs, but nothing else has ever made me feel like that, so I'm pretty sure that that's what it was. And as somebody who is still overweight, I think it's been quite interesting for me to have that alongside COVID and have to deal with how that feels, because it feels quite unpleasant, I have to say. So I've got two perspectives, I suppose, really, on having COVID and being a GP. And so when I'm going to talk today, I'm going to talk about me, that's me, as a GP working in A&E, but then I also wanted to talk today about the patient perspective, because I think it's really important that as I'm sure lots of other people are in their talks, to look at things both from a healthcare professional point of view, but also a person living with overweight or obesity point of view. And so I hope that today I'm able to give you both points of view during my talk. That's certainly been my intention. Some of the pictures today that I'm using, I just need to mention, come from the World Obesity Federation, who are brilliant and have a picture bank that you can use, so that we're trying to get away from using some of the more stigmatizing images of obesity. So that's where some of my pictures come from today. So I'm going to start with a little bit of the science, because although this is both a healthcare professional and a patient or layperson talk, I think it's really important for us all to understand a little bit about the science of obesity and COVID. So the first thing to say is, are you more likely to get COVID if you have overweight or obesity? So I've been doing a literature trawl, and the answer is pretty much probably not. Now, we know that having overweight or significant obesity can slightly suppress the immune system, but it doesn't seem from the literature that you're more likely to get COVID than anybody else. So I don't think we need to really be thinking along those lines. But what we do need to think about is what happens if you do get COVID. And we know, and there's no point pretending that we don't, that if you have significant overweight or obesity, you are more likely to come to harm from your COVID, either ending up in intensive care or unfortunately dying, than somebody of a normal body weight. And so I've been sort of looking through the literature, and it seems to be that the worst risk is if your BMI is over 40, and if it's between 40 and 44, then your risk of death is increased by 40%. And if it's over 45, then it's increased by 90%. But like so much when we think about statistics, there's actually no baseline here. So if you look at the case fatality rate for COVID, it's vastly variable depending upon the population. And there's so many complicating factors that it's really difficult to say that, yes, your rate of death is increased by 90%, but 90% of what? So we know that it is increased. There's no point pretending that it isn't. But the exact figure is difficult to say, although you wouldn't think that from some of the the headlines that have been written. The other thing that's quite interesting is when we're thinking about COVID, we tend to talk about COVID. Oh, sorry, something's popped up on my screen. We tend to talk about COVID as being most risks to the elderly, but actually, when we're talking about obesity, it seems to be that those under the age of 60 are more at risk. So the population normally that's most at risk is over 70, but a little bit less when it comes to obesity. It's actually under 60. And then the other interesting statistic that came from a study in came from a study in America that was published just last week. They seemed to say that from their stats, which was looking at people who'd been admitted to hospital, that the risk was vastly increased for men, but not for women. Now, I haven't found that borne out anywhere else, but we do know that the risks are increased for men. So I think we need to say at the moment that the risks of COVID are increased for both men and women with overweight and obesity, but it may be that actually if you're male and have obesity, you are at much greater risk than if you're female. And we know that the risk of the influence of estrogen and testosterone are making quite a big difference. But that's a whole other talk in itself. And what about children? Well, we don't have many statistics from the UK because actually we've been very lucky and children haven't really been affected here, although children have been admitted and sadly a few children have died. But a study from the States showed they looked at 576 children who were in hospital, and actually a much bigger proportion of those were children who had obesity than in the normal population. So 38% had obesity, and if you look at the figures at the bottom, the highest rate of obesity in the general population is between 12 and 19 years at 20.6%. So it is increased, but then again, confounding factors, did they have other problems as well? So it's not a definite that children with obesity are more at risk, but we probably need to consider that that might be the case. Now, when we're thinking about who's more at risk, so if we're medics and we're seeing patients who have symptoms of COVID, who's going to be more at risk? Now, when we talk about obesity, and in the world of obesity, as I'm sure someone's going to talk about today, BMI tends to be what's used, but we know that it's not really very good. And so we should probably actually be using the Edmonton Obesity Staging System to look who's more at risk. And the reason for that is that the Edmonton system looks at inflammation in the body rather than just your relationship with gravity. And it does that. And a study recently was brought out that looked at inflammatory molecules, so your CRP, your C-reactive protein, and also your interleukin-6. And what they found was that the more signs of inflammation you had in your body, from your Edmonton Obesity Scale, which we know looks at how your obesity is affecting you, so medical, emotionally, and functionally, the more inflammation you have, the higher up the Edmonton scale you seem to be. And what correlated is that actually you had markers of inflammation, so your CRP, your interleukin, went up in a linear scale as your Edmonton scale figure rose. So we know that actually you're probably more likely to suffer from problems with COVID and obesity the higher up the Edmonton Obesity Scale you are. Now, it's not used very much outside of obesity specialist services, but perhaps we should be if we're seeing patients in our surgeries or wherever we happen to be. If we look at where they would fit on that scale, if they're high up, they're more likely to come to harm from COVID than if they're lower down. So a high BMI but no signs of inflammation means that they're less likely to have problems. So I think that's something that we should be considering. Now, why does inflammation matter? And this is where we do get a little bit sciencey, so bear with me. Well, it matters for a few reasons, but there are some other reasons that having obesity and overweight cause problems with COVID. If you end up in intensive care and you need support breathing, we know that if you have a lot of particularly central obesity, you'll have slightly decreased lung capacity. Your lungs will be squished a little bit, and your abdominal fat will push your diaphragm up a little bit. And so that makes ventilating a patient, breathing for them, harder. We also know that if you have a lot of subcutaneous fat, so a lot of fat under the skin, that can cause problems with blood flow to the skin. So if you're in intensive care and you're very vulnerable, we know that you're more likely to get infections from your skin breaking down. So there's a lot of reasons why it can be a problem. We also, of course, need to think about the other problems that people with obesity and overweight might have. So that might be diabetes, it might be high blood pressure, might be other sorts of cardiovascular disease. And they absolutely have to be factored in here. And what I've tried to do is look at the figures where just obesity has been taken into account rather than obesity plus comorbidities. But of course, if you have those things, you are more likely to come to harm than if you simply just have obesity in itself. The inflammation. Why was I talking about inflammation? Well, we know that obesity is a disease of chronic inflammation. And why is that? Why do people with obesity and overweight have problems with inflammatory things going on in their body? Well, it's all to do with your adipocytes or your fat cells. So we know that we have a lot more markers of obesity, so a lot more little inflammatory chemicals that go around our body produced by our fat cells, and they're things called interleukin-6, TNF alpha, and leptin. Leptin is one of the hormones that is to do with hunger, but it also is an inflammatory molecule, and these then form other inflammatory molecules. So factor 7 and von Willebrand's factor, fibrinogen, oh, my head's gone mad, plasma activating factor 1. I think that's what I'm saying. Hopefully that's right. My brain just had a moment. And this causes huge amounts of inflammation, which then interferes with cells using their glucose, and that leads to the death of fat cells. So the fat cells help produce the inflammation then kills the fat cells. And when white blood cells come in to try and eat up the dead fat cells, they then release fat molecules into our system. And those fat molecules then tend to cause problems in themselves. So that makes us much more likely to get cardiovascular disease and problems with diabetes. But when we're thinking about problems with COVID, it can cause other issues as well, which I'll talk about in a minute. So this cycle of chronic inflammation is a real issue, and we need to think about how we manage obesity and how we deal with obesity with regards to COVID, with regards to this inflammatory process. Because COVID makes it worse. So we've talked about fat cells producing inflammation, which causes the death of fat cells, which causes more problems. But fat cells, adipocytes, also express this chemical receptor, or this locking site called ACE2. And we know that this tends to be the one that COVID likes to link onto. So COVID binds to the cell, infects the cell, and then causes the cell to die. The more dead fat cells you have, the more inflammation you have. So that cycle we talked about earlier will be made a lot worse by COVID. And if that's happening within your body and you're unwell, you're going to get inflammatory problems in your lungs, you're going to get blood clotting too much, or unfortunately when things get really bad, blood clotting not enough, and you're going to get lung injury. There's also some thoughts that people with obesity, because they're having more of this free fat floating around their system, because of the death of the fat cells that normally contain the fat, that they may get what's called fat embolism syndrome. So they get lots of these little molecules of fat going into the bloodstream, and that can cause damage as well. So COVID causes an awful lot of problems in all sorts of body systems, and it's an inflammatory disease in itself. And because people with obesity have more inflammation going on anyway, they're more likely to have problems as a result. So it's a rather difficult and problematic issue, because we know that inflammation can be difficult to treat, and this may be one of the reasons that some of the studies to do with steroids have helped, because they reduce this inflammatory process. So if we now think about how people with obesity and overweight have felt during this time, and we think about some of the things that we're reading. So I have been horrified, to be honest, by some of the reporting about overweight and obesity during this time. And if you're reading these headlines, so obese people may be told to stay at home, you're going to have to stay at home if you're too fat. Obesity's increased the risks, so people are getting scared. This study, or this headline, seemed to say that even if you were only a little bit overweight, there seemed to be more of a problem. and people talking about why people with obesity are dying. So people who have overweight and obesity over the last sort of 5 months have been constantly bombarded by headlines telling them that there's problems. And this does, of course, apply to other groups as well. This applies to other at-risk groups. And I'm only talking about people with obesity and overweight today, but if you're somebody who is from a background where you might be more likely to get COVID, so if you came from a Bangladeshi population, for example, who are more at risk of problems with COVID, and you had obesity, it's like a double whammy of fear. So we're in a really difficult time for people at the moment. And certainly when I'm seeing patients or when I'm talking to friends, we know that there's a lot of fear. People are incredibly scared. And we know also that, unfortunately, a lot of the reporting, there's been a massive increase in stigma. People have been reporting really horribly on the news about COVID. So it's been a real issue. And then when people start to talk about how we manage COVID in the future in any sort of second wave, as people keep saying there might be, and we don't know whether there will be, people with obesity are starting to feel bad. They're going to take up the hospital system. It's going to be a bit of an issue. And so there's this guilt that then comes with that. And I'm sure you're going to talk a lot today about the stigma and guilt of obesity. Well, COVID has just magnified that horribly. And so people have really been struggling with it. And what we know is that no amount of shaming or stigma is ever going to boost someone into losing weight. We know that it has the opposite effect from all the research. So it's just been a little bit of a difficult time for people with overweight and obesity. And government plans to help people lose weight have unfortunately so far not really focused on any of the real issues. So here in England, we've been told to get a bike. Well, that's okay, but that can be really hard if you have really significant obesity. And we know that exercise isn't great for losing weight anyway. So it might be that people are feeling under pressure from their doctors, from their families, from their friends to sort of start looking after yourself properly because you're going to have problems with COVID. And that's just going to magnify those guilt and shame feelings that people with obesity have already. And as I said already, the reporting's been horrible. So these pictures, they're called the headless fatty pictures, which seem to be appropriate according to news producers. And they're actually horrible. And so there's just been more and more of this stuff on the news. So it's been a tough time, actually, for people with overweight and obesity. So what should we do? Lots of my medical friends who know I'm interested in obesity have been saying, well, should we just tell people to lose weight? And there was even a plan to ring up all patients who were registered with GP surgeries, telling them that they should just lose weight because that will help them with COVID if COVID comes back. And the answer is no. There's never going to be a good time to tell someone to go on a crash diet, a very low calorie diet of some sort without any help. Because although, yes, it might slightly reduce your risk if you can lose the weight, we know that there's a lot of other things going on at the moment in people's lives, and so we're probably just going to be setting people up to fail. So what do we need to think about, both as people who might have overweight or obesity, but also as healthcare professionals? Most important thing is we need to balance. We need to balance risks, we need to balance those against other things that people have got going for them, that's sort of healthy aspects of their life. And also we need to balance that against the overall risk of COVID, which actually at the moment is quite low in a lot of places. I know it's increasing, and it's increasing in Ireland at the moment compared to England, but it's still actually at comparatively low levels. And so we need to think about this perception of risk. One of the things about COVID has been that people's risk perception has perhaps changed. And so people need to be helped to work out their individual risks. What are their comorbidities? What are their problems? What are they in an area with lots of COVID? Are they in an area with less COVID? So having really good discussions and thoughts, if you're an individual, about your risks is a good idea. We then need to think about economic circumstances, because we know that COVID is going to cause problems for most people's economy. Some people will lose their jobs, some people will be on a vastly reduced income, and that's going to have huge implications, which other people are going to talk about today, about food poverty and the ability to afford what other people might consider a healthy diet. So the economic circumstances and societal circumstances of each individual needs to be taken into account when we're thinking what people can do. And then there's the emotional aspect. If you're anything like me, the last 5 months has definitely been a corona coaster of emotions. It's been pretty tough, it's been pretty miserable. I'm still finding it incredibly difficult. And I think we need to be very aware that at the moment people might not be sleeping because of the stress. We've all got massive cortisol going on. We're exhausted from uncertainty and not being able to plan. And so this really isn't the time to set someone up to fail by telling them to go on a diet. So we need to think about how someone's emotional state is at the moment. And as I said before, shaming never works. Shaming someone into losing weight just never works. So for any healthcare professionals, don't say, well, this might be the time to think, have put on weight. This is, you don't want to get COVID and then you might die. So I think it's time, you put some effort in now. Just don't do it. It's never going to work. It's going to have the opposite effect. You may, however, have people who think, do you know what? I would like to lose weight. And I would never, ever suggest to somebody that they don't make efforts. But again, as other people are going to talk to you today, have realistic conversations. Perhaps just lose that 5 to 7% of body weight and then keep it off for a while. Don't think, right, I'm going to lose 5 stone straight away and make drastic changes. But supporting people to get healthy, to get active, exercising, perhaps not to lose weight because we know it doesn't work, but it does shift that visceral fat, which is the more dangerous fat. So let's perhaps think about how we can encourage people who want to make changes to make sensible and healthy changes at this time. And I think if you're a healthcare professional, if you've got patients who have hypertension or diabetes, making sure that you do your best to, or actually mood problems as well, that you do your best to help those other problems be as best controlled as possible so that if they do become unwell, that can be managed. And what else? We need to talk about the rules of discussing weight. So we need to ask permission to discuss weight. If they've come in or you're having a remote conversation over the phone with someone you don't know very well, think carefully about discussing weight. Ask permission and accept that they might not want to talk to you now. And that's okay. That might not be at the top of their priority. Don't, as I've already said, set people up to fail by encouraging rapid weight loss. When patients don't want to do that, or when people don't want to do that, that's not going to be something that's going to be particularly helpful for them at the moment. And then think about other things that they can do. So it might be that you want to check they don't have sleep apnea. You might want to make sure that their hypertensive medications are okay. So think carefully about what you can do for your patient to keep them as healthy as they can possibly be at the moment. But this isn't the time to phone up all your patients with a high BMI and say, you really should lose weight because COVID. It won't go down very well, quite justifiably, to be honest. And I think it's also really important to acknowledge the fear and how they might be feeling because things are tough. It's scary. When I was diagnosed, or when I wasn't diagnosed because I couldn't have a test at the time, but when I realised I had COVID, I was terrified, actually. I mean, even Alexa in my kitchen blushed because I swore and cried. And I thought, oh, I'm fat, so I'm going to die. And I have asthma. And at the time, we didn't know that wasn't really a risk factor. So I was convinced that, death was imminent. And actually, I did update my will. I'm still here. I'm recording this, so I'm okay. But I think we need to think and think about how our patients are feeling and acknowledge their fears and thoughts. Okay, I'm going to leave it there. I hope that was helpful to you, and I should be able to help with some Q&A as well.